Hi, good evening, everyone. My name is Marichu Antonio, and I'm the Executive Director at Action Dignity. Can I share my screen now?
Yeah, just go ahead.
Can you see?
Yes.
Okay. So I would like to start by introducing what Action Dignity is. It's an Alberta-wide society that was registered in 2002. So we're 18 years old. We're a charity organization with 111 ethnocultural member organizations. We do leadership training, community engagement and action, research and policy systems work, public awareness, and government relations. So, what Anila had presented, this is Action Dignity. So, we're one of the 17 organizations that are here. Now, what are our objectives in participating in the COVID response in this collaborative? There are three levels that I'd like to share with you. One is to provide immediate relief and support to those who are in quarantine and in isolation by connecting them to the different services. The other is to conduct community-based prevention or community action through engagement, education, and awareness. Actually, I would like to appreciate the presence here of the different ethnocultural organizations, faith communities, and grassroots organizations that are here today. I could see your names and organizations, and they're playing quite a big role in the prevention and raising public awareness. And they've been there for a long time too, working with service provider organizations. A third level of objective is to address the barriers and aggravating factors that contribute to vulnerability. Mayor Nenshi, Minister Sahani, and our minister have talked about the important role of essential workers and the situation that they're in that contributes to their vulnerability. So we would also like to address some of the roots of those barriers and vulnerabilities. And in order to do those three levels of role, we thought of showing you the different players here in addressing the COVID crisis. So these are the infected residents, and these are their immediate contacts that we need to protect and support and provide help with. And these are the service provider organizations, such as the Center for Newcomers, Immigrant Services Calgary, the Immigrant Educational Society, that provide comfort food, sanitation supplies, financial income support, mental health supports. But along with that, too, is this large base of grassroots organizations, the ethnocultural organizations, the faith communities, the faith leaders, business leaders, and some of the ethnic media and the media that provide support to these who are infected, but also do a lot of community prevention work in raising awareness and making people prepared in case they get infected. We also work with government who also provides, the packages that they have distributed and also provide funding to these service provider organizations. Aside from these two, some of the charitable foundations and the organizations like United Way and Calgary Foundation. But underneath are the underlying causes of vulnerability. And the mayor talked about this awareness of rights of these essential workers, rights to workplace safety, how to say no, how to assert your rights if you don't feel safe going back to work, addressing also issues of poverty that cause, all these housing conditions and low income. We also need to address these issues. So how are we going to do all of these in the immediate future? We came up with the idea of a multilingual emergency response call center. And this is the number 1833-217-6614 that is connected to our cultural brokers who speak all these 20 different languages, and we could add more based on the need. We have actually now 16 brokers who speak most of the languages here, if not all. And I'm going to explain to you how it is working. So we have this call center, a virtual call center, and these are where the brokers are stationed based on their different language groups. We have 16 of these right now, and we meet every day to assess and to debug the system. So they're called the multilingual cultural brokers, who speak directly to those who are infected with a virus. How do we get the people who are infected with a virus? We get dispatch calls from Alberta Health Services. So they are connecting to us. Whenever they talk to clients, they connect to us and they speak to those depending on the language groups. And these are called the Alberta International Medical Graduates. And then we also have calls from the residents themselves who are impacted by the virus or know of people who are impacted. We also get calls from like Children's Hospital to 111, and we're now becoming an information hub too. So there's a lot of work entailed in training these brokers. Now, the starting point that our brokers have when they call these residents who are infected with COVID are, first, we show we care, that we want to provide a comfortable healing process for them. We also show that we appreciate and we value them as members of society, as volunteers, especially as essential workers, that they're doing a lot to support our economy and our well-being, and they're in the front line. So we emphasize, we value them, that's why we care for them, and that's why they need to heal. But we also empathize because they usually we also take frantic calls, like they're afraid for their children, they're ashamed of the stigma, they're afraid to lose their jobs, and they actually hesitate to ask for help. So we always emphasize, we need you to be stronger so that you can give back later and you have a place to give later on. So these are the starting points that our brokers use. Our brokers are actually members of the community themselves and feel for these people. And so we use a lot of empathy and care and appreciation. So when did we start? So the idea started sometime first week of December. And when we learned that Alberta Health Services could not give us directly the phone numbers of the people who are infected for security or for security purposes, we came up with the idea of a hotline. So December 12 was when we first launched the hotline. Oh no, December 16, I think. So we set it up, we tried to debug the system, and while we were doing that, we trained 30 cultural brokers who spoke the 20 languages. We hired 16 of them right now. And then after that, our brokers started to do outreach and information drive to all those networks that I mentioned. And we started getting calls from the hotline, from AHS, referrals from community. But this is still a slow process. That's why you're here today, in order for you to spread the word. And then later on, we'll be getting some lessons from the COVID response and how to move forward. At this point, we have funding until January 15. So we need to talk about how we can move forward after this.